Fan the transducer slightly cranially to achieve the left apical 5-chamber view. Activate color flow Doppler and use the touchpad or trackball to move the color flow box into the aorta, covering the aortic valves. Increase the PRF to raise the Nyquist limit to 100 centimeters per second, or as high as it will go. Fan and angle the transducer slightly to find the greatest flow or disturbance. Select Spectral Doppler and use the touchpad or trackball to place the spectral Doppler cursor in the highest aortic flow. Activate Spectral Doppler. You may also need to raise the baseline and increase the pulse repetition frequency to get the most accurate measurement. Observe a number of waveforms and freeze the image. Use Cine Loop to scroll backwards and choose the largest waveform. Activate the Calculations package and select Aorta. Measure the maximum flow and save the measurement to the patient record. Aortic stenosis results from a defect of the aortic valve, making the actual opening of the valve smaller than the left ventricular outflow tract. Aortic stenosis tends to be more common in dogs than in cats. With subaortic stenosis, the aortic valve is normal, and a structural defect below the aorta is causing a narrowing of the left ventricular outflow tract. If you have or suspect a subaortic stenosis, you may also wish to move the color flow box into the left ventricular outflow tract, or LVOT, to look for a flow disturbance. Fan and angle the transducer slightly to find the largest flow disturbance. Use the touchpad or trackball to move the spectral Doppler cursor into the flow disturbance and activate Spectral Doppler. Observe a number of waveforms and freeze the image. Use Cine Loop to scroll backwards and choose the largest waveform. Activate the Calculations package and select LVOT, or left ventricular outflow tract. Measure the maximum flow and save the measurement to the patient record. Some dogs and cats have a bulge of the dorsal septum which protrudes somewhat into the left ventricular outflow tract. This is a common abnormality in cats. The septal bulge may cause a flow disturbance and murmur. If the flow disturbance is mild, no treatment is needed. The flow disturbance or patient symptoms may be rate-related, meaning that at rapid heart rates, a murmur and symptoms may be present, but at slow heart rates, no murmur or symptoms are noted. In some cats and dogs, the septal bulge will move further into the left ventricular outflow tract and obstruct flow during left ventricular systole. This is known as dynamic left ventricular outflow tract obstruction. It is a form of subaortic stenosis. Aortic insufficiency is significant only if it causes left ventricular enlargement. From the left apical 5-chamber view, you fan caudally to return to a left apical 4-chamber view. The right atrium and tricuspid valve are on the left lower part of the ultrasound screen. For the best spectral Doppler measurement, you slide the transducer cranially 1 rib space and fan slowly caudally to find the opening of the tricuspid valve. This will move the tricuspid valve toward the center of the ultrasound screen. Activate color flow Doppler and use the touchpad or trackball to move the color flow box into the tricuspid valves. Select spectral Doppler and use the touchpad or trackball to move the spectral Doppler cursor into the flow disturbance. Activate spectral Doppler. Observe a number of waveforms and freeze the image. Use Cine Loop to scroll backwards and choose the largest waveform. Activate the Calculations package and select Tricuspid Valve. Measure the maximum flow and save the measurement to the patient record. If color flow Doppler shows the presence of a tricuspid insufficiency, select spectral Doppler and place the cursor in the main flow. Activate spectral Doppler. Observe a number of waveforms and freeze the image. Use Cine Loop to scroll backwards and choose the largest waveform. Most ultrasound machines do not have a standard calculation for tricuspid insufficiency, so choose standard calipers and measure the greatest flow. Label the image tricuspid insufficiency, or TI, and save the image. Your measurement of the tricuspid insufficiency will also give you a pressure gradient. The right ventricle is the pumping chamber, and the right atrium is the receiving chamber of a tricuspid insufficiency. Normal pressure in the right ventricle is 20 millimeters of mercury. A right ventricular pressure gradient of 30 millimeters of mercury or higher indicates a pulmonary hypertension.